Welcome to this training video on conducting an antenatal care visit on eHESA. This video will guide you through how to document and manage an ANC visit, ensuring that all critical maternal health information is recorded accurately. For this session, we'll walk through a first ANC visit for Ange at the health center, demonstrating how to enter key maternal health details and ensure appropriate follow-up care. Hi, I'm Nurse Ketia. My patient Ange has arrived at the health center, so let's begin her ANC visit. When you first open eHESA, you will go to the patient directory and enter her name. This arrow next to her name allows you to access the patient demographic and medical records. It allows you to edit demographic information if needed. Since this is a new pregnancy for Ange, let's click on the document arrow, then antenatal care and start an encounter. Then we click on antenatal care and first antenatal care encounter. These are all to-dos for this visit. As the healthcare provider, make sure to complete all to-dos before ending the encounter. Let's start with pregnancy dating. We're gonna ask when was her last menstrual period. It was July 23rd, 2024. The system automatically calculates her estimated due date and gestational age. This means that Ange is currently 30 weeks and 40 days pregnant, and she's due to have her child April 29 of 2025. And now onto her obstetric history. We can confirm that she's currently pregnant. She has had 1 term pregnancy live birth, 1 preterm pregnancy stillbirth, 1 abortion, and 1 living child. So she's gravid of 4, which means she's been pregnant 4 times. Additional obstetric history questions include: has she had a pregnancy within the last 18 months or more than 5 years ago? No. Has she had any previous C-sections? No. Has she had any of these complications in previous pregnancies? Yes, Ange has had preeclampsia. Next, we document Ange's other medical conditions. Has she had any of these chronic conditions before? Yes, she's had asthma. Does she have any of these physical conditions? No, she has none of these. Has she ever had an infectious disease before? Yes, she's had tuberculosis in the past. Has she had any general depression in the past? Yes, she has. Now we'll conduct a comprehensive physical exam. Let's start with her vital signs. Her blood pressure is 165/95. Her heart rate is 60. Respiratory rate is 13. Temperature is 37. Then hit save. Her height is 150 centimeters. She weighs 50 kilograms, which brings her BMI to 22.2. Her MOAC is 20 centimeters. This places her in a moderate malnutrition category. Next is a core physical exam. Her hair, eyes, and neck are normal. Heart and lungs are normal as well. Her abdomen is pregnant but otherwise normal. She has no swelling in her hands, but her legs show signs of edema. Then hit save. And now let's perform her obstetric exam. The fundus is palpable, so we hit yes. Her fundal height is 30 centimeters. This is measured from the pubis bone to the top of the uterus and is usually the same as the EGA. Her fetal position is head down, so cephalic, and there is fetal movement. Her fetal heart rate is 140 beats per minute, and there's no previous C-section scar. Her breast exam shows normal, and yes, I showed Ange how to perform a self-breast exam. And now onto family planning. Ange chooses to have an IUD placed after delivery. She has also received iron and folic acid supplements and also mebendazole in the last 6 months. So we hit yes for both. Ange also received a mosquito net for malaria prevention. When all done, hit save. Let's now review danger signs and symptoms. This is to assess for any danger signs that may require immediate attention. Ange is not experiencing any of these danger signs, so I'll click none of these and hit save. These are symptoms that are not danger signs, but they may occur during pregnancy. Ange is experiencing burning with urination. I select that and hit save. I would then ask her follow-up questions based on her symptoms. She's not having any of these. However, she's experiencing frequent urination, so I'll select that, and she's not experiencing any flank pain. I hit save and continue. Now onto immunization. Ange has received 3 tetanus immunizations prior to today, and she will receive a 4th one today. Let's then hit save and continue. We now order and document essential ANC lab test. Her partner is negative, so I select no. The test will be performed today and it will be done at point of care. Point of care just means that it will be performed at the moment. The test result is negative. Ange is known to be HIV positive, so I will select yes. Her syphilis exam will be performed today at point of care and the result is negative, so I select that and hit save to continue. Ange is known to be hepatitis B positive, so I will select yes. The malaria test will be performed today at point of care as well, and it was negative, so let's hit save and continue. Her blood group test will be performed today in the lab, and when it is ready, we can update it via case management. The urine dipstick test will be performed today at point of care with a short dip test. The results are +1 protein, 6.5 pH, and glucose is 0. The hemoglobin test will be performed today in the lab. Let's hit save and continue. The random blood sugar test will also be performed today at point of care before a meal, and the result is 98. So I'll record it and hit save. And now let's do a mental health screening. Overall, Ange's mental health is stable and positive. So then let's go to next steps. And now on to next steps. So Ange is showing signs of a UTI and mild to moderate preeclampsia. So I'll go ahead and provide medication, referral, and health education. I've provided appropriate health education to her. Ange is showing signs of a UTI, so I'll prescribe her this medication, and since she's at risk of mild to moderate preeclampsia, I'll go ahead and refer her to the hospital. Now we're going to pause this encounter because we still have the lab test results that I haven't recorded. Let's go ahead and go to case management to find them. Let's go back to the home page, then click on case management, then the arrow next to her name, and then lab results. So now I'll enter these lab results because she had them drawn and I received them from the lab. Her blood group is A positive and her hemoglobin is 8. Based on these lab results, Ange is showing signs of mild to moderate anemia, so I'll go ahead and go to next steps and provide treatment. I'll give her a higher dose of iron and folic acid. When the encounter is complete, we get a progress report which provides a comprehensive summary of the visit. Great, you are now ready to complete an ANC visit at your health center on eHESA. Enjoy and thank you for watching.